psychological premedication. What do you mean by psychological premedication? It's not always that you need to give premedication to the patient. Suppose you have a patient of anticipated difficult airway. If the patient is super anxious and you can't give him any benzodiazepine, you feel that if I give him any anxiolytic and if he gets even slightly sedated and I am not able to ventilate him, I will not be able to secure his airway. So you want to be doubly careful in such patients. So what works is counseling the patient. Counsel the patient, speak about the procedure, let him know that you're there with him, and also prepare the patient well. If you're preparing for fiber optic intubation, make sure you follow all the steps that I've mentioned in the video on fiber optic intubation. You give proper topical analgesia, you give good amount of transtracheal local anesthetic to the patient so that he does not feel the awake intubation and he is not very anxious. So that is called as psychological premedication. We can also use it in children we can allow the parents to come inside the operation theatre with the child if the child is crying too much and not coming with the medical staff, and you can ask the parent to hold the mask on the child and ask the child to blow a balloon. So while he blows a balloon, we hold a mask with sevoflurane and put the child to sleep. Then you can also use this in high risk pregnant patients. In them, you don't want to give any kind of anxiolytics and they are very scared about spinal anesthesia, but you tell them the pros and cons of both spinal versus general anesthesia. You explain the situation to them, and this leads to psychological counseling of the patient prior to surgery, and they go ahead with whatever is the best choice for them. What you need to be a good anesthetist is not just medications but also counseling and time for the patients, empathy, and the knack to make sure that they feel comfortable with you throughout the perioperative period. Thank you.